Colleagues, family, and friends, welcome to the 2022 Fellowship Forum.
Thank you for joining us today for the 11th Annual Randall Lewis Health and Policy Fellowship Forum. My name is Janie Boren, and I'm the Executive Director of the Fellowship. I'd like to thank today our universities, because without them, we wouldn't have such amazing fellows. This year, we had 14 universities participate. And since the universities, many of them were still doing remote classes, some of our students were participating from across the country. And one actually participated from Canada. I'd also like to thank our sites and our preceptors. Our fellows work closely at the sites for eight months, 400 hours. That's a lot of preceptor and mentoring, and we appreciate everything that those sites do for our fellows. When the fellows are finished, those projects are relevant experience that can go on their resumes. And with many of them graduating in May, it's so helpful to show experience on the resume. I'd also like to thank two great support leaders for our fellowship. One is Dr. James Martinez. He is an expert in GIS and data analytics. James works with our fellows in giving them skills on how to use GIS. And for many of the fellows, it was their first time using this wonderful tool. For those who had experience, it was a great refresher course for them, and they were able to use it on their projects this year. Deborah Barath is a great mentor and leader who help our students every year. This year, we had topics covering leadership, coaching, mentoring, resilience, and the topic of the day, things that were important for students. And we spent a lot of time in sharing and working together and talking about things that were important to the fellows. I'd also like to thank Randall, because if it weren't for Randall Lewis, we wouldn't have this amazing fellowship. Over the course of the last 11 years, we've completed 250 fellowship projects. And if it weren't for Randall, we wouldn't have his vision and guidance and leadership to help us as we continue to move forward and make a difference. So thank you again for watching and being supporters of the fellowship. Have a good evening.
11 years ago, the fellowship began, and Randall Lewis has been the leader behind the scenes, supporting not only financially, but as a guide and mentor. Mr. Lewis inspires by his example. He is a reminder that each one of us can make a difference. Thank you, Randall Lewis, for this fellowship that helps guide future leaders in making our communities better.
Congratulations to the 2022 cohort of Randall Lewis Health and Policy Fellows. What an accomplishment. You are now among the 250 distinguished alumni serving the world, helping to improve the health and well-being of our communities. What a time to be in public health leadership. COVID has certainly changed our world over the last several years. So much death and destruction, but also presents us with so much opportunity to improve our systems of healthcare and our systems of public health. We're counting on you as leaders to be a part of that. What can we learn from the pandemic and the virus? What were the characteristics that caused it to transform our world forever? 3 years ago, most of us had never even heard of COVID. And now there's not a single person on the planet that can't define or has been impacted by COVID. Well, let's look at the characteristics of a pandemic and a virus. It's exponential in growth. It's self-organizing. It has an efficient use of resources and uses available resources. It's adaptive. It's distributive in intelligence, and it thrives in duress. Those are some principles that really cause something to go viral. I challenge us to think about those principles and perhaps use them for good. Take this moment of disruption and really turn it into opportunity. Over a decade ago, when Randall and I visioned the Randall Lewis Health and Policy Fellowship, our goal and our vision was to help develop leaders to navigate the complexities that we would be facing in the future. Never did we imagine that it would be so soon and here in front of us. We created this program for you. Randall Lewis Health Policy Fellows, the world needs you now more than ever. So we charge you and challenge you to go in the world and lead infectiously. The world certainly needs you now. We look forward to hearing about all the successes in the future and hope that this network and the relationships that you've made during the program serve you in serving our world. We want to thank you for your time in the program and congratulate you on your success.
Greetings, Randall Lewis Health and Policy Fellows. I'm Monty Roulier. I'm president of the Community Initiatives Network, and it's my honor to join you for this final fellowship forum. I want to start by commending you for being selected and for completing this fellowship and for your commitment to improving the public's health and our community's health. The Community Initiatives Network has been a partner in this fellowship and is really pleased to have had a fellow this year. Shout out to Colleen Corrigan, who served us so well over the last 8 months. And I know that all of you served your partner organizations and communities really well through this fellowship. And so gratitude for all of you for your service through the fellowship. I've been asked to share just a little bit about Thriving Together, this emerging approach to advancing the health and well-being of our communities. It's an approach, frankly, that's building on the evolution of the healthy communities, healthy, equitable, sustainable communities movement for some decades now. And I hope in sharing a little bit about the Thriving Together approach that you will see some of yourselves and some relevance as you step into your roles as next generation change makers and stewards. So let me share my screen here so that I can share just a little bit about Thriving Together. Let's see here as I pull that up. So Thriving Together started off as really a broad inquiry into how do we convert the loss into renewal, the loss that we started to see through the pandemic and through greater awareness of the social and racial inequities that have for too long plagued our country, for the massive economic development in a time of really significant political polarization. How do we kind of convert this loss into renewal? And started with a premise of how do we do this in a way that really builds into or taps into the resilience that is present in our communities, and how do we start to organize around locally and nationally around one unifying measurable goal, and that is all people, all places thriving, no exception. Springboard for Thriving Together actually was initiated when the federal government engaged a few of us that have been actively involved in the healthy, sustainable, equitable communities movement and asked us to kind of engage a number of the leading non-governmental organizations and a lot of the more mature place-based coalitions working to improve health and well-being to really see how these organizations, we're starting to see how we might recover, not just as a status quo, but to recover with greater resilience, greater humanity, and greater equity. And that's really what launched what is known as the Springboard for Thriving Together. And in the federal government actually is starting to use this as a basis for their interagency planning, and really seeing this as a legacy moment, as a moment of not, again, just tinkering and incremental change, but an opportunity to really fundamentally change the health and well-being and advance equity in our country. So thriving together starts with this notion of thriving, all people and all places thriving. And it starts with an understanding that since the beginning of our country, our systems have not been designed for everybody to thrive. And that we, even before the pandemic, had huge percentages of our population who are suffering and struggling. And that what it takes are these vital conditions that conspire to really support anybody, wherever they are, no matter where they are in their life course, to thrive, to have long, thriving lives. And so these vital conditions that you can see on the left-hand column are just a very plain-spoken, comprehensive way of talking about the types of conditions, the assets that we need to make sure are present for everybody, no matter, again, where they live, no matter where they are in their life course. Things like thriving natural world, sustainable and clean air and clean water, and freedom from climate hazard, the basic needs for routine healthcare, accessible, affordable food, and freedom from trauma and addiction and violence. Those are all of the things that kind of fit under basic needs. Humane housing, as it suggests, not just to have housing, but housing that is humane, that's affordable, that is safe. Meaningful work and wealth, understanding that not just a paycheck, which is incredibly important, but work that confers dignity, that supports individual and family sustaining wages. Again, that brings dignity to people's lives. Looking at lifelong learning, not just K through 12, as important that is, but really the first 1,000 days of life, and a K through 12 that supports not only our academic and intellectual development, but also our emotional development and the pathways, whether that's through colleges or community college or vocational tracks that really support people into meaningful work and wealth, and all the way through the life course opportunities for lifelong learning. Reliable transportation, as it suggests, reliable, consistent, affordable transportation, including public transportation. And then at the core there, belonging, civic muscle. There's enormous amount of research around well-being, around the need for that all of us have wired to feel like we belong. And this idea of our collective muscle to be able to create change together. The Thriving Together framework is really built on this idea of also the legacies. We need to really understand the legacies that we've inherited and our ability to create new legacies, and situated not just in the vital conditions, but understanding if we're going to really create thriving people and places, we need to understand the role that our local democracy, the renewing of our civic life, as you can see on the right-hand side, economies that work for everybody, well-being economies, and the social, emotional, and spiritual life, and culture that is so important to everybody's well-being, culture of caring and compassion. So this is a comprehensive way of really looking at what it takes to thrive. And I'm going to pick up a little more detail on a couple of these. But I'd like to double click, first of all, on this idea of belonging and civic muscle, which really sits at the center of these vital conditions. Again, this idea that belonging, John Powell and his team at the Othering and Belonging Institute starts to describe belonging as a co-creation process. Whose voice, people feeling like they belong, that they have an opportunity to co-create their futures and to join with others across differences in order to create the conditions for people to thrive. And so the belonging and civic muscle come together because it's both about our sense of belonging as individuals, but our ability to join with others to affect change. And in many ways, it's the belonging and civic muscle is a vital condition that animates, that makes it possible for us to work together at different levels to really enliven the vital conditions that we all need over on a routine basis in our lives. So I'm just pulling out one of those vital conditions. For example, as we had in this process, we had over 64 authors leading kind of place-based and research and practice groups that are expert in all these vital conditions that have long histories in these areas. So for example, around meaningful work and wealth, our partners at Prosperity Now convened and brought together a lot of the folks that they work with around what a more fair and just economy would look like, and a reminder of the legacies that we've inherited and how so many in our country have been excluded from our mainstream economy, including the growing and significant wealth gap, particularly with Black families and Black households as some of these statistics on the left suggest. And recognizing what is it that we really want to define as meaningful work and wealth, and what are some of those pivotal moves that are immediately in reach that we know are working in some communities that could be spread across communities, like establishing a minimum wage tied to local cost of living, or really decoupling benefits for employment so that everyone has access to paid sick leave and caregiver leave and health insurance, and not being linked to an older model of having all those be linked to an employer. There's some other beyond pivotal moves in this chapter that you all can look into, including these ideas of baby bonds, really investing at the very beginning of life to accrue benefits and to grow wealth and to shrink the wealth gap for all kids, and particularly with an eye to those that have inherited unjust legacies and excluded from our economy. So one of the other interesting parts of the Thriving Together vital condition framework is really this idea that these vital conditions are not separate. They're very much interrelated and interconnected. And what we need to do is really think about how we multi-solve with our strategies and investments, and just mention the meaningful work and wealth. And you can see that highlighted. If food security, one of the vital conditions, is a unifying priority, how do we address that in the same way that we're really looking at strategies that would simultaneously benefit this vital condition of meaningful work and wealth? For example, making sure that we're assuring fair pay and paid sick leave for food workers that have been hit so hard during this pandemic in particular, how we start to really adjust food subsidies and investment priorities that preference and are really balanced to support BIPOC and smaller farmers. So these are the types of strategies that are examples of multi-solvers, recognizing as you bump up there with lifelong learning, just how important, if we're going to really look at advancing learning for everyone, recognizing the role that hunger and malnutrition plays in impeding the learning process. Or in humane housing, really understanding that affordable housing is a solution in many ways to food insecurity, as too many families are looking at balancing the trade-off between rent and food, or living in places where there's not good reach and access to healthy, affordable foods. Same with other vital conditions. You can see on here reliable transportation, this obvious connection between a healthy natural environment and how we proceed with food packaging and waste in more sustainable ways, or toxins and genetically modified food, and how we provide incentives to make sure that we are producing healthy foods, or practicing farming practices that protect against soil erosion and reduce the amount of water required for food production. So these are all examples of multi-solvers, and belonging in civic muscle. Again, food is a great example that everything that we do can be done in ways that boosts or advances belonging and grows our civic muscle or not. We know that food and bringing together different cultural groups and community groups is a great way of building belonging civic muscle. There's an enormous amount of interesting work that's happening across the food movement around food security, food justice, and food sovereignty. So how do we strengthen that muscle and bring those groups together to really advance policy changes that make a difference? By the way, Colleen has done some great work with us through some of her fellowship of building out some of these multi-solving tables across the vital conditions. So thanks, Colleen. So I've mentioned that thriving is a measurable objective. And so for many years, the Gallup organization has been measuring thriving as it relates to percentage of population struggling and suffering. And there's a use of a Cantrell's ladder as a way of measuring people in a self-report fashion, who's thriving, who's suffering, who's struggling. And we can see, obviously, over the course of the last 12 years, as COVID hit and the compounding challenges that came with those times, or in these times that we, in many ways, we're still in, of course, we saw a drop in thriving. It's very sensitive to some of these external and internal stimuli and these disruptions. And the goal with the Thriving Together approach is not just to get people back to the status quo, the high level hallmark on this of 55, but to really move beyond not just recovering the status quo, but how do we start to move into places where all people in all places thrive, and be really intentional on how we measure that at different levels. So what does it take to thrive together? I think one of the interesting things that emerged in this kind of crowdsourced endeavor of all these leading NGOs and community-based groups is really being able to zoom out from those vital conditions and recognize the larger context in which these dynamics are taking place in our society, recognizing that the vital conditions that many are not experiencing and haven't experienced before, need to be balanced with adversity, the urgent needs that folks are experiencing, or many families and individuals, for food insecurity, addressing housing and economic insecurity, and recognizing that we need to balance our investments and our actions to make sure that we don't invest all of our times and resources just in urgent needs, because we can't urgent need our way out of into thriving. And so we need to really think about how those balance of investments. The other important element of this is really, again, zooming further out and recognizing that where we are now, we need to really understand the legacies that we've inherited, the legacies of dignity and inclusion, of civil rights, of innovation, of the social capital in our communities, but also really since the inception of our country, the trauma and exclusion, the harm, and most recently in these past centuries, the redlining and all the different historical legacies that have caused people to be excluded and not to have access to the vital conditions they need to thrive. And we see that part of the answer to this is really recognizing those legacies of both dignity, inclusion, and harm and trauma, and through shared stewardship. And how do we address those, and how do we build on those assets? So there's a lot to say about shared stewardship. I'll just mention in this briefly, what's really required of shared stewardship if we're going to create future legacies of inclusion and of moving us towards thriving together. Stewards, and one of our partners in Thriving Together, the Rethink Health, describes stewardship as people and organizations who take responsibility for working with others to expand the conditions that everyone needs to thrive together, beginning with those who are struggling and suffering. So what's required in many ways is affirming human dignity, really establishing and working towards social justice and social inclusion that has been long too off the radar screen too often in our country. That we do this by really strengthening the belonging and civic muscle that really takes place and comes to life at a place-based level in the context of community, that start to unlock new assets and human capital and social capital and really untrap the human potential. So this is really one of the key elements that we see in being able to recover with greater resilience and start to move towards thriving. To recognize that the vital conditions are very much interrelated, that there's synergy behind those, and as really supporting local stewards and taking multi-solving strategies to advance these vital conditions. And finally, just recognizing that we have within our power collectively at different levels the opportunities to create new legacies for the next generation and even for today. This quote by Coretta Scott King, I think, is also a nice way of recognizing what shared stewardship looks like and what it means. As she says, love is a powerful force. It is there for everyone to embrace. That kind of unconditional love for all of humankind, that is the kind of love that impels people to go into community and try to change conditions for others, to take risks for what they believe in. So as next generation change makers, I just encourage you to step into these new vocational pathways with a spirit of shared stewardship, with a willingness to take risk, and with a spirit of love. And just thank you for what you're doing and what you will do on behalf of our communities and behalf of our country. Good luck and thanks.
Hi everyone, I'm Amanda Thurman, and I'm a family nurse practitioner and a doctoral student at Azusa Pacific University under the mentorship of Dr. Teresa Dodd-Butera, and partnering with the Center for Better Beginnings. I am studying food insecurity for the Randall Lewis Health Policy Fellowship. I will start with some statistics and go into my treatment and policy recommendations. An astounding 1 in 3 persons worldwide and in America are food insecure, and in California that number is 1 in 5. Now, food insecurity is defined as not having enough food to live an active and healthy lifestyle. Food insecurity causes multiple ill health effects. In adults, we see depression, anxiety, obesity, and poor control of diabetes and hypertension. What happens is trade-offs occur. Food that is really healthy is expensive, and so trade-offs occur of more energy-dense, high-carbohydrate food, and that can lead to ill health. In children, we see anemia increasing, and asthma, and increased dental cavities, and also depression, anxiety, and symptoms of ADD, because they don't know where their next meal might be coming from. In pregnant women, we see pre-pregnancy weights that are higher, which can lead to poor birth outcomes. And we see in postpartum women that they fear breastfeeding, that their milk is not enough because they are hungry. Now, in the healthcare setting, research has shown that providers are not comfortable screening for fear that they don't know what to do if a patient is food insecure. There is an amazing tool called the Hunger Vital Sign. It's a 2-item screening tool, and you simply ask the patient, in the last 12 months, have you run out of food and not had enough money to buy more, or have you worried that you'll run out of food? If a patient is identified as positive for either one of those questions, then they can be referred to resources, and we can help understand some of the background reasons behind their chronic illnesses, such as diabetes, hypertension. In California, we have an amazing program that supplements patients' food budget if they qualify, and that's called CalFresh, and it has been shown to pull 20 to 30% of families out of food insecurity. So connecting to those resources for those that qualify can be life-changing. We also need to educate every healthcare professional on performing the Hunger Vital Sign and identifying food insecurity for patients so that they can truly understand the health effects of food insecurity. My policy recommendation is this, because we do have CalFresh, but those patients with an documented status, an immigrant that is here in California without documented status does not qualify for CalFresh. And we know that preventative disease management is much cheaper than dealing with a problem on the end. So my policy recommendation is that we could extend CalFresh benefits to undocumented workers that are working full-time and contributing to society so that we can help mitigate some of these effects of chronic illness. Thank you for listening.
Greetings. My name is Anthony Izorga, and I am a 2021-2022 Randall Lewis Health and Policy Fellow. This year, my site is SCAG, so the Southern California Association of Governments, which is designed as a metropolitan planning organization that encompasses 6 counties. I was on the planning strategy team as an environmental justice and equity fellow, and my preceptor is Anita AU. I was tasked to track the progression of Senate Bill 1000 within the SCAG region. Senate Bill 1000 is a California legislative bill mandating the integration of environmental justice in local jurisdiction general plans. It was approved on September 24th, 2016. The cities and counties with one or more disadvantaged communities need to integrate environmental justice within their general plan, whether through integrating policies and goals within their current general plan element or creating its own element, so environmental justice element. Disadvantaged communities are the top 25% of the highest scoring census tract with health, economic, and environmental burdens as defined by California Protection Agency. So to track this progression, we created an Excel sheet that had first identifying all the 191 cities and its counties, whether they have disadvantaged communities within them, their latest major general plan update, their latest element update, and then any Senate Bill 1000 related information within the general plans, whether that's in draft mode, public scope, or approved, even those that may not have started the process at all. We had tracked that. And so all 6 counties and then 93 cities have disadvantaged communities within them. Of that, 4 counties and 34 cities have adopted Senate Bill 1000 or complied with Senate Bill 1000. And this was by mid-March 2022. Amongst others are within the draft or public scope stages. So there are going to be more to come, which is great. And so with this progression, I had also was working on updating the SCAG's environmental justice toolbox. And the way these two projects can go together is, one, cities and counties can use the map I created to track this progression, finding out whether they have disadvantaged communities within them, and then if they need help tweaking or guiding them on what this integration could look like in their general plans, can use the toolbox to use that as a guide, which has 9 environmental justice related topics within them. So perfect examples that cities can departments can take from, and that is planned to come out in June 2022. I would like to thank Anita Ayu, SCAG professionals, Janie, and all of my fellows. And I've learned a great insight from you all, and I hope you all have a great day.
Hello, my name is Ashanti Jones. I am currently a Master's of Public Administration student at the University of La Verne, and through the Randall Lewis Health and Policy Fellowship, I have been paired with the nonprofit Build Healthy Places Network. Build Healthy Places Network is a national nonprofit organization that is dedicated to health equity through non-traditional cross-sector collaboration, focusing on the improvement of well-being for marginalized communities. Through their field building, they supply tools, resources, and actively create connections with the intention of creating cross-sector partnerships that leverage community-centered investments. My project was assisting in the development of their multi-sector playbook for rural healthcare. This resource is one of many guides produced by Build Healthy Places. It is an action-based guide that encourages cross-sector investments in rural areas and upstream investment from hospitals to address the lack of community resources and serve as a resource for potential partnerships. Investing upstream is a separate approach that focuses on the community's determinants of health and quality of life. Materials and methods used for the creation of this playbook includes case studies, interviews, articles, and insight from rural development leaders in Build Healthy Places Network's National Rural Committee. Strategies applied and addressed are economic opportunity in support of workforce. Specifically in that strategy, there are multiple case studies of partnerships that showcase healthcare sector upstream investment, like the Southwestern Vermont Medical Center partnering with the Bank of Bennington and the town of Bennington, Vermont, to develop Healthy Homes program that renovates and develops homes to provide affordable housing opportunities and encourage home ownership in the community. Following strategies such as supporting local control, strengthening infrastructure in support of healthcare access, and increasing resources have tangible examples and content that guides and promotes cross-sector engagement. By also identifying cross-sector partners in the rural ecosystem and considering all potential partnerships amongst them, there is possibility for more change and improvement. With the goal to complete and release within the spring, Build Healthy Places has provided tools that create change in our communities and resources to sustain them. Thank you for listening to my presentation and have a good rest of your day.
Hi, everyone. My name is Brandon, and I am currently a Master's of Public Health student at Claremont Graduate University. As a Randall Lewis Fellow, I was paired with the City of Riverside Public Works Department at City Hall and Riverside Corporation Yard. My projects were mainly focused on environmental health, where different methods were utilized to reducing greenhouse gas emissions long-term to mitigate the current climate change problem in the world. It also follows the initiatives of SB 743, which is a California law that was passed to reduce greenhouse gas emissions through reducing the amount of vehicles per miles traveled, and SB 1383, which is similar to SB 743, but with the main focus on reducing organic food waste in landfills instead. I was responsible for reaching out to other transportation agencies in California to obtain the necessary information and documents for the development of our VMT mitigation project request for proposal for one project and developed outreach materials to promote the food waste pilot program for another. As a result, I was able to accomplish these objectives with both of my teams. By completing the RFP, the team will use it to hire consultants that can be part of the VMT mitigation project development in the future. By completing the outreach materials, the City of Riverside residents are now more aware of our food waste pilot program, and they also have more knowledge on what they can do next to help. Some recommendations were also made to the projects moving forward. such as including a stakeholder committee, which would be composed of different parties such as the community, Chamber of Commerce, City Hall, and hospitals at the City of Riverside as part of developing the VMT mitigation project later to ensure the best results. In addition, having more resources and incentives for participants would increase success of the food waste pilot program when implemented citywide later. Ultimately, the projects implemented by the City of Riverside would have a significant impact on reduction of greenhouse gas emissions in the future. Thank you so much for listening.
Everyone, my name is Caleb Portales, and I'm currently an MPH candidate for the School of Community and Global Health at Claremont Graduate University. I'm here to talk to you all about today the Health Equity Research Project for the Program of All-Inclusive Care for the Elderly, also known as PACE. Affiliated with the PACE Health Equity team, this research-based project aims to identify gaps in access to healthcare for the Latinx population in Seattle and King County, Washington. Descriptive in nature, our overall goal is to find ways to better serve the Latinx population who are PACE eligible by reducing identified health inequities through applying recommendations supported by social epidemiological research. For our methods, a correlations analysis was conducted using Census Bureau data to observe any associated relationships between social forces that intersect and further increase barriers to healthcare access for the Latinx population. Additional qualitative interorganizational analyses observed data collected by PACE with regard to grievances reports and disenrollment data for their Latinx constituents to understand some common trends from the beneficiary experience and provider's perspective. To help the organization understand how their organizational structure impacts the feasibility of implementing health equity initiatives, an additional pathways analysis was organized to identify supportive communication channels. The aforementioned methods are all supported by literature review conducted based on identifying best practices throughout different PACE organizations on how to better serve the Latinx population. For our results, the analyses are still ongoing, and results have yet to be calculated with visualizations. However, significant progress has been made, and the results will be ready for the presentation day. For our discussion, we would like to note that this research is meant to provide a deeper understanding of the Latinx community at large that can benefit from the PACE program. Understanding forces that work together and against those underserved by healthcare systems, understanding individual patient experiences within PACE, and understanding organizational structural relationships can also help support PACE health equity initiatives for years to come. In conclusion, descriptive analyses will be used to influence operations to improve the delivery of health equity-based initiatives moving forward to better serve the Latinx population through informed decision-making, research-based problem identification, community engagement, marketing efforts, and the role of social epidemiological study design to support community intervention at large. Thank you all so much for your time, and it is an honor to have been affiliated with Providence and PACE as well as CGU.
Hi everyone, my name is Colleen Corrigan and I recently graduated from the University of Southern California with undergraduate degrees in human biology and nonprofits and social change. I'm a second-year Master of Public Health candidate at USC Keck School of Medicine with a concentration in global health. This year I was fortunate to have 2 site placements through the Randall Lewis Health and Policy Fellowship. One was Community Initiatives Network and the other was a partner nonprofit, the Institute of People, Place, and Possibility. For more than 2 decades, Community Initiatives Network has been working with and learning alongside place-based collaborations to advance well-being and equity across the nation. Community initiatives build steward and changemaker capacity to ensure that all people and places are thriving, no exceptions. Its work is guided by a set of vital conditions which encompass everything from humane housing to lifelong learning and belonging and civic muscle. On the data side of the work is IP3, which builds capacity for change through strategic thought partnership, curating resources, and IP3 Assess. IP3 Assess is a web-based tool with a robust list of indicators, interactive maps, and shareable reporting. A product of this partnership, Community Commons is an online public goods platform that supports changemakers working to advance equitable community health and well-being across the country with over 27,000 resources. Under the leadership of Stacy Wegley and countless other colleagues, including Elizabeth Hardig, Sarah Ivy, Erin Barbaro, and Roxanne Fulcher, I was able to contribute to an incredibly diverse range of projects this year. I was given the creative freedom to write original pieces and collections for Community Commons on everything from the American Rescue Plan to the consequences of environmental racism to my own experiences with well-being on my college campus. I contributed as a co-author on a health systems toolkit for shared stewardship, and I supported data capacity needs for metadata, quality assurance processes, and resource curation. I had the opportunity to interface with countless other partners in the field, including the North Sound Accountable Community of Health, Rethink Health, and Wellbeing in the Nation Network. I developed a deep appreciation for the hard work that goes into creating and sharing health resources and the power of meaningful partnerships and data-informed decisions. Throughout the entirety of my fellowship, I was challenged to expand my understanding of health and well-being, to improve my writing and analysis skills, and to work collaboratively across disciplines and across time zones. As I wrap up my work with Community Initiatives Network and IP3, I am more invigorated and excited to be working in the field of public health than ever.
Hello, everyone. My name is Daniela Flores. I am a second-year Master of Public Health student at California State University, Northridge, with a placed emphasis on community health education. Currently, I am a fellow at Adventist Health Glendale Community Wellbeing Department, which focuses on helping construct and support the city of Glendale and its surrounding communities' quality of life. Under the guidance of my preceptor, Justin Henderson, we primarily collaborated on the development of the school's mental health program. The program's focus is to provide a range of mental health resources to offer support to the teachers, students, and families at the Glendale Unified School District. As we all know, mental health is especially prevalent due to our current environment as a result of the ongoing pandemic. Now, the strategies employed included taking a community engagement approach, talking to the superintendent to discuss the school district needs and priorities, followed by emphasizing the voice and choice principle, learning about the teacher and students' ideas, priorities, and perspectives. We produced recommended preventative strategies and resources based on their prioritized needs by searching the literature, evidence-based programs, and effective programs implemented in other schools. Additionally, every month, health education newsletters are delivered to 23,000 students and families at the Glendale Unified School District. Some of the program's future prospects include mapping out all the different potential resources and partnerships to align those in a more strategic and focused way using a collective impact model, as well as seeking additional grant funding. The knowledge and skills I have learned have been invaluable to my professional and personal growth. I would like to thank the Randall Lewis Health and Policy Fellowship for providing me this amazing opportunity to work with Adventist Health Glendale, and my preceptor, Justin Henderson, for providing me support throughout my work. Thank you for listening.
Hi, my name is Daniela Gillette. I'm a second-year DRPA student at Loma Linda University. Through the Randall Lewis Health Policy Fellow Program, I was placed as a Data Innovations Fellow at the Institute of People, Places, and Possibilities. IP3 is a nonprofit organization working to create healthy, equitable, and sustainable communities through strategic thought partnerships that facilitate community change through use of data, technology, and storytelling. My project at IP3 specifically focuses on the contributions that I made to the enhancements of IP3 Assess, which is a web-based solution that uses data frameworks and technology to support cross-sector partnerships and concerted actions around public health issues. According to the National Center for Drug Abuse Statistics, since 2000, there have been over 700,000 drug overdose deaths in the US. $35 billion is the federal budget for drug control in 2020. And 53 million, or 19.4% of people 12 and over, have used illegal drugs or misused prescription drugs within the last year. For this project, the National Center for Wellness and Recovery wanted to create a two-part opioid and substance abuse data framework to better understand the burden of opioid and substance abuse. Using data from CDC Wonder, the Substance Abuse and Mental Health Services Administration Opioid Treatment Program Directory, and Bureau of Economic Analysis, we constructed a framework that uses a holistic approach to reveal the factors that at many times are overlooked and exposes the areas to apply individual and community level approaches to decrease and prevent substance abuse. These factors include history of substance abuse, mental health factors, access to care, treatment, and recovery, amongst many other things. Through IP3Assess, we are providing meaningful data analysis, allowing for an apples-to-apples comparison against state and national benchmarks, a web-based application that is designed to make community needs assessments effective, and reports that deal with evidence-based interventions and strategies aligned with community needs. As a result, many organizations like the National Center for Wellness and Recovery have a roadmap for examining upstream community and individual level factors contributing to opioid and substance use disorders, as well as access to data that will be the guiding compass for effective decision-making and beyond. Community needs assessments continue to be invaluable for public health challenges, as it encourages organizations and leaders to identify rising issues, build strategic partnerships, and most importantly, act. Thank you for watching my presentation.
Hi everyone, my name is Diana Cervantes. I am a UC Riverside Masters in Public Policy student. I am currently placed with the city of Rialto, where I'm working with their Rialto's Healthy Community Initiative. My preceptors are Barbara McGee, who is the city clerk, and Christian Gutierrez, who is the senior office specialist. So within my current project, I am working with their farmers market, where in their farmers market, recipients who have EBT can come and utilize their funding there. So I go ahead and make those exchanges for them. But not only that, but mainly focusing with market match. So not only can recipients come and use their EBT funding at the farmers market, but they can also get additional funding because of market match. With the use of market match, as long as the recipient uses $10 out of their funds, then I can go ahead and match them and give them additional $10 for fruits and vegetables that they can buy there at the market. And the purpose is to help combat food insecurity and malnutrition with the residents of Rialto, as it has become very difficult, especially during COVID time. And especially bringing up COVID, because of COVID, there was PEBT cards given out to children from K to 12 who are eligible to receive these fundings to help them get access to food. And that being said, not only can people come use their CalFresh, also known as food stamps, EBT, they can also use their EBT cards at the farmers market. And in addition, they can also get matched, as it is used as, it's basically used as the same as a CalFresh EBT card. That being said, something that was also stood out is that there was a language barrier before for the residents of Rialto, as 58.9% of residents who are 18 to 64 speak Spanish. And before they had that barrier where it was difficult for people to understand. But when I was as a fellow placed there who speaks Spanish and English, I helped eliminate that barrier. And in addition, with the CalFresh enrollment because of COVID, and because of PEBT, there was a high increase of usage for the market match program. And overall, we saw that there was about 349 new customers that were utilizing the market match program. And in addition, there was a total market match CalFresh customers, there was 1,603. So there was a really high increase of need, and it is really important to even address this because having the market match program is really helping not just residents, but people who are local to the farmers market have more access to healthier.
Hello, everyone. My name is Beth Allen, and I'm a dual master's student at Claremont Graduate University with a master's in positive health psychology, and I'm a candidate for a master's in public health. I'm currently a fellow at Upland Unified School District, focusing on nutrition education through cafeteria redesign. Upland Unified was the recipient of an Action for Healthy Kids grant, part of which was a portion to redesign 5 elementary school cafeterias. Nutrition education is paramount for building a foundation of healthy eating habits and positive attitudes towards nutritious food. Schools play an important role in establishing nutrition literacy by providing students with the necessary tools and knowledge to make healthy choices. Studies show that the built environment is just as important a tool in providing nutrition education as are nutrition lessons. Messages about how nutrition is portrayed can affect food and snack choices. Positive images of nutrition and healthy foods on cafeteria walls can favorably affect students' attitudes towards nutrition and healthy eating. Furthermore, it can increase fruit and vegetable consumption, not only at school, but as home as well. Additionally, the physical environment can reduce stress and affect social behavior, such as making healthy food choices when among peers. Our goal this year was to redesign cafeteria walls to make lunchtime a more positive experience while encouraging healthy eating habits. I designed a survey to administer to elementary schools to evaluate students' attitudes towards lunchtime in general and their cafeteria in particular. Results of the survey showed overwhelmingly that students loved lunchtime but were unhappy with the way the walls looked. This allows us an opportunity to create positive change by changing the aesthetic of the walls, and also gives us an opportunity to incorporate nutrition lessons into the design of the space. It was also my job to secure a local artist who will create a mural on the cafeteria walls. This is still a work in progress, and we are currently working with school principals to fine-tune the desired look of the design. Once it's finished, we will have an art installation which will not only look beautiful, but have the power to establish healthy habits for a lifetime. Thank you for listening.
Hello, my name is Emmanuel Sanchez Ramos, and I am a second-year student in the Master of Public Health at California State University, Los Angeles. In collaboration with Adventist Health, I assisted in the planning and strategizing of blue zones within the community of Boyle Heights. More specifically, I helped the community well-being team as they work with local leaders to mitigate any obstacles while Boyle Heights begins the journey to receive Blue Zone Project certification. Blue Zones Project is designed to improve the overall well-being of communities using people, places, and policy as pillars to transform the surroundings. One of my objectives included developing a project aimed at helping communities implement evidence-informed programs that lead to greater stability where people live long, healthy lives. My project, with a focus on healthy aging and education, consisted of hosting nutrition classes to introduce community members to healthy food options and help them make healthy choices. I developed a nutrition education curriculum to enhance knowledge among older adults and promote intake of fruit and vegetables. The goal is to show how healthy eating and greater access to fruit and vegetables are all connected to reducing levels of hypertension and diabetes and ensure health equity. The curriculum includes 5 nutrition classes of 60 minutes each. The sessions were conducted once a week at the local resource center. Evaluation and pre- and post-test data was collected at each session. In the results section, all participants indicated to be 55 years of age and older and of Hispanic and Latino origin. While data is still being collected, so far, pretest results indicate 65% of participants reporting that they have nutritional challenges related to aging, and they also reported low intake of fruit and vegetables within the last 7 days. While post-test results show that 50% of older adults want to make wise food choices if given information on healthy foods, meal planning, food shopping, and ways to enhance their eating habits. In conclusion, post-test results and evaluation data show the importance of addressing food insecurity in vulnerable communities. Data obtained from each session will be used to develop educational material such as nutrition fact sheets, tips, and recipes for healthy eating to help residents make healthy, easier choices. The next step includes distribution of nutrition material, and once the project is finalized, data collected will serve as a resource to develop materials for the community and to help make food insecurity a key policy focus at the local level. Thank you so much for your attention.
Greetings, everyone. My name is Eva Vera. I am a healthcare administration student at Loma Linda University School of Public Health. My Randall Lewis project is an assessment of mental health needs in the pediatric population in the Riverside County, and it was conducted with the Riverside University Health System. So to give it a little bit of background, in 2019, the CDC released a report that showed the suicide rate increase of 76% between the years of 2007 and 2017 amongst kids aged 10 to 19 years old. These rates are alarming. So the goal of our study is to understand the mental health needs of kids living in the Inland Empire, assess the resources available to them, and develop a strategy to better serve that population. To conduct our project, we used 3 different methods. The first method was a primary data collection. So we created a questionnaire, and after that, we conducted a key informant interview where we called all the school districts in the Riverside County and gathered data from those different schools. The second method was a secondary data collection. We used tools such as the Inland Empire Health Plan Map, the Geographic Information System, also known as GIS, and we use research and literature review. The third method was a data review. We calculated the ratio of patient to provider per city. We did a resource comparison per city, and finally we wrote a needs assessment report. The result of our study showed that some school districts had more resources than others, and some cities had more providers for kids than others. So for example, the Corona Norco Unified School District had 8 therapists available on campus to assist kids in mental health distress, while the Palo Verde Unified School District only had 1 psychologist available on their campus to serve their students. So in conclusion, the research revealed the disparities among cities in terms of available resources, and it also revealed the need for more preventative measures for child suicide. We will use the result of this research to better serve suicidal patients that check in to the ER at the Riverside University Health System. So I would like to end by thanking the Randall Lewis Health and Policy Fellowship, Loma Linda School of Public Health, and finally, thank the Riverside University Health System. Thank you.
Hello, everyone. My name is Eva Zamora. I'm a second-year student at the University of La Verne and a candidate for the Master of Health Administration program with a concentration in public health. As a fellow with the Randall Lewis Health and Policy Fellowship, I was matched with Inland Empire Health Plan, also known as IEHP. IEHP is a not-for-profit health plan that was established in 1994 with only 62,000 members. But today, IEHP serves more than 1.4 million members in San Bernardino and Riverside counties. IEHP is invested in the continuous growth and wellness of their members, but also of the team members that make IEHP. Under the supervision of Michelle Palafox in the Learning and Development team, I was given the task to help create and develop a wellness catalog that will be added into their e-learning training system. This wellness catalog will be a continuous project with ongoing lessons, classes, education, and fitness portions. These classes will be on demand for the team member to pick depending on their motivation or need. And these classes will also be done in person, but if the team member can't make it in person, they will be added on to the e-learning system. I'm very grateful for everything that I was able to learn at IEHP. I was actually introduced with a lot of team members, different departments that make IEHP, so it's definitely not easy running a health plan. I'm grateful for the University of La Verne the Randall Lewis Health and Policy Fellowship, and IEHP for allowing me this opportunity to continue to grow. And I'm excited to use everything I've learned and put it into play with my community. Thank you.
Good evening, everyone. My name is Genesis Ordonez, and I am a Master in Public Health candidate at California Baptist University. A special thank you to Randall Lewis Fellowship, Partners for Better Health, California Baptist University, and the City of Paris for this opportunity. You have all played a vital role in my journey, and for that I am very thankful. The site that I was placed at was at the City of Paris, Community Services Public Health Division. Here, the leadership has a vision about bringing health equity to the community through programming, initiatives, and various innovations that include park adaptations, changes in policy, accessibility to nutritious foods, and physical activity. The next step into bringing inclusiveness and equitable programming and equitable accessibility in a built system all starts with this GIS map that I created. The GIS map highlights both current and future green spaces, parks, trails, community garden, specific amenities to each park, and the programming hosted within each of the locations of the parks. Now, here you can see the 27 parks, all highlighted with their specific color to categorize them based off where they fall, but also the purpose that they serve. In addition, you can see which area code they are located in, the zip code, to better see how we can address the residents. Another piece of information present is a buffer that is a 10-minute or a 0.6 mile radius. This will highlight not only the residents that we are targeting and how to take it to the next step, but which areas are the gaps and how we can focus on the residents that fall within or outside the buffer. In addition, each park contains its specific amenities in addition to the programming offered by the City of Paris. Now together, we can use this GIS map, kind of take a step out and see and look at the big picture. Some of the ways in which this GIS map will help with next directions include programming, grant applications, evidence, helping enrich the decision-making process with the City of Paris, the team, and moving forward, especially of helping our communities and our families. Thank you.
Hello, my name is George Karam, and I'm a first-year Master of Urban and Regional Planning candidate at the University of California, Los Angeles. My passions have always been at the intersections of transportation, sustainability, and public health, and for this reason, I'm honored to be a part of the Randall Lewis Health and Policy Fellowship cohort of the 2021-2022 academic year. Since October, I've worked alongside the sustainability team at the Southern California Association of Governments, or SCAG, under Senior Planner Kimberly Clark. Entitled Urban Trees as a Nature-Based Solution for Mitigating Urban Heat Island Effect and its Impact on Community Health, my main focus these last few months have been on the disproportionate impact extreme heat has on disadvantaged communities and how urban trees can be an invaluable tool in mitigating these effects. Urban heat island effect occurs when cities replace native vegetation and other land cover with pavement, buildings, and other surfaces that inadvertently trap heat and increase surface and air temperatures to levels high enough to impact community health. In an effort to cool hotspots like this across the region, SCAG is currently developing a tree planting suitability web tool designed to help jurisdictions in the 6-county SCAG region, made up of Ventura, Los Angeles, Orange, San Bernardino, Riverside, and Imperial counties, identify areas the most in need and best suited for additional tree canopy cover, a nature-based solution to UHI effect with a myriad of co-benefits for communities from shade and carbon capture to mental health and traffic safety. While on the team, I conducted an in-depth literature review on the effect of urban heat on public health, heat mitigation through the built environment, tree planting best practices, and the nexus of urban tree canopy cover and equity. After acquiring the data, our team developed a system to score communities on a variety of factors. This suitability score considers socio-demographic makeup, including population density, age, gender, income, and poverty, as well as land cover and urban heat severity data to produce a score for each community at the block group level. On the suitability scoring map, areas with low suitability fall further below the average, marked in yellow or light orange, while areas with higher suitability fall further above the average, marked in red or black. Integrated into the web tool will be additional resources on tree planting best practices, funding opportunities, alternative heat mitigation strategies, as well as existing programs that will set cities up for success when addressing the effects of urban heat in neighborhoods across Southern California. Urban trees require strategic placement that depends on climate, maintenance, and public rights of way. By adding this to the toolbox of urban forestry departments region-wide, jurisdictions can avoid the guesswork and focus on providing more shade for their communities in need. Lastly, I'd like to again acknowledge and extend a thank you to the Randall Lewis Health and Policy Fellowship Program for this opportunity, as well as Kimberly Clark and Emily Rotman from SCAG's Sustainability Team. Thank you.
Hi, my name is Iris Vanegas. The title of my poster is Addressing the Social Determinants of Chronically Ill Patients in the Community Health Improvement Program, or CHIP, at San Antonio Regional Hospital. Patients who frequently utilize the emergency room for non-emergencies qualify for this program. The most common chronic illnesses that CHIP patients face include diabetes and hypertension. In September 2021, CHIP began using the social needs screening tool from the American Academy of Family Physicians. During enrollment, patients are screened for social needs and appropriate referrals are made by the program's social worker. The top 3 most common needs are finances. In second place, there's a tie for employment and food, and education placed third. When finances arise as a need, most patients are generally provided with a $50 voucher for use at a local thrift store. The voucher can be spent on anything the patient wants, no questions asked. 9 of the 20 patients who have received vouchers so far have used them. By providing spending money at the thrift store, CHIP intends to alleviate patients' financial burdens so that they can be better focused on their health. To date, $1,100 have been dispersed. Patients who screened positive for the most social needs received the most financial support and vouchers from the program. CHIP intends to reassess patients' social needs prior to exiting the program and follow up on their experience utilizing vouchers. Thank you.
Hello, everyone. My name is James Morimoto. I am a Master of Public Health student at Claremont Graduate University. I am also the Active Transportation Fellow at the Southern California Association of Governments, or SCAG, the Metropolitan Planning Organization for Southern California. My preceptor is Philip Law, and under his guidance and mentorship, I was assigned the task of creating best practices recommendations for tracking TNC or private rideshare company and public transit agency partnerships within the SCAG region. These partnerships supplement the existing transit systems and allow for better accessibility, reliability, and sustainability of these systems. For my project, I conducted a short survey with 26 participating transit agencies within the SCAG region, and I also conducted informational interviews with the TNCs that operate within the SCAG region. The results from these interviews and surveys are currently being used to support the development of the 2024 Connect SoCal Regional Transportation Plan. In conclusion, some of these best practices recommendations that SCAG should consider when tracking current and future TNC transit partnerships include conducting an annual survey for transit agencies, conducting informational interviews on an annual basis for TNCs, and allowing for compatibility with GIS data augmentation, and considerations for follow-up questions to allow for qualitative data to support the descriptive statistics from the survey findings. Lastly, the transit agencies and the TNCs also mentioned challenges having the initial discussion to establish these partnerships. SCAG can actually help facilitate these discussions to create a better environment to discuss and constructively discuss these partnerships. In conclusion, I would like to thank the Randall Lewis Health and Policy Fellowship, the team at SCAG, and my preceptor for allowing me to work on this project and learn more about how transportation and public health are interconnected with this experience. Thank you for listening to my presentation.
Hi, my name is Jean-Quil Williams, and I am currently in the DRPH Preventive Care Program with Loma Linda University School of Public Health. And during this project, I had the pleasure of working with Riverside University Health System High Risk Access and Resources HER-Care program. The HER-Care program offers expecting mothers with high-risk pregnancies specialized care and treatment with an innovative approach. By utilizing telemedicine, pregnant mothers and their providers can access specialized care at select Riverside University Health System community health clinics that are conveniently located throughout Riverside County. These mothers are connected with Riverside University Health System team of board-certified maternal fetal medicine providers and registered nurses to increase their accessibility, convenience, and 24-hour support, allowing patients timely access to the expert high-quality care. This study specifically that I was included in will reinforce HER-Care program planning, helping to understand clinical and health system facilitators, as well as beneficial interprofessional resources, development, allocation, all within the Riverside County to minimize risk factors for high maternal risk mothers. Our project overview will determine an association between pre-existing comorbidities and adverse high maternal risk health outcomes, as well as determine the interactions between comorbidity and severity of high maternal risk in Riverside University Health System, as well as the Riverside County sample. During this time, we will also determine an association between distance to the nearest clinic and adverse high maternal risk health outcomes. The HER-Care strategies to overcome high maternal risk include patient education and behavioral counseling, improving maternal health data collection and reporting methods, and increasing access of quality, comprehensive reproductive health care. Throughout this study, we have also determined that in Riverside County and amongst many communities, high maternal risk is creating a health disparity, which is defined as a particular type of health difference that is closely linked with economic, social, or environmental disadvantage, and as such, a disparity of social justice in health. In conclusion, this study will support the life course perspective and maternal health goals, those being to validate pregnancy as an integrated continuum of women's health, which links maternal exposure and infant development, to shift priorities to address external systemic disparities across social gradients, racial ethnic groups, and cultural demarcations, as well as emphasize risk-appropriate care interventions to maximize autonomy, reinforce self-efficacy, restore patient-provider trust, to reduce postpartum risk factors, and lastly, establish sustainable clinical and social support systems in promotion of investing in long-term maternal child health. It has been a pleasure working with the Riverside University Hospital System, specifically my site preceptors, Dr. Brian Oshiro and Dr. Ronald Johnson. Thank you for your support, and that will conclude my presentation.
Hello, everyone. My name is Jorge Barahona. I am currently a Master's of Public Health graduate student at the University of Southern California, as well as a Randall Lewis Health and Policy Fellow. Throughout the fellowship, I've been working with the Policies for Livable Active Communities and Environments, or PLACE program, within the Los Angeles County Department of Public Health. Prioritizing the safety of pedestrians and cyclists requires investment in infrastructure and education. In 2015, the state of California recognized this growing need with the passage of AB 902, allowing local governments to implement cyclist pedestrian diversion educational programs with the approval from local law enforcement. In Los Angeles, we're seeing high rates of collisions that have resulted in serious injuries or fatalities. Additionally, cyclists and pedestrians of color have been cited at a higher rate, resulting in unequal treatment from law enforcement. The LA Times published an expose highlighting this inequity in stops. As a result, the Board of Supervisors of LA County have expressed interest in conducting a pilot through a motion. In order to develop the pilot program, Place spoke with community shareholders, including CBOs, criminal justice reform advocates, local law enforcement, and other local government agencies to develop a strategy for implementing diversion programs within LA County. My project at Place focuses on facilitating a cyclist and pedestrian safety and citation diversion program in unincorporated Los Angeles County. The main goals of the proposed diversion program would be to increase pedestrian and cyclist education, as well as increasing their safety and reducing financial impact of citations. These safety educational courses would be open to all interested. However, those that qualify for a diversion opportunity would have their citations voided upon completion. These programs would also provide any needed equipment, such as helmets or lights, and any additional resources. From our conversation with stakeholders, it seems ideal that a pre-filing model, a model that prevents tickets from being submitted to the courthouse, would alleviate some of these inequities created by law enforcement. This model would require law enforcement to track and monitor citations to implement properly. The program would also collect data on individuals cited and reasons for citation in order to evaluate effectiveness and to determine whether or not the program should expand to other areas of LA County. Thank you for your time and listening. Special thank you to my preceptor, Alexis Lance, and the Place team, as well as thank you to Janie, the Randall Lewis Fellowship, and the Winish family.
Hi everyone, my name is Lauren D'Souza, and I am a graduate student pursuing my MSHS degree at Western University of Health Sciences. I am a Randall Lewis Health and Policy Fellow for Partners for Better Health. My fellowship site was with Adventist Health Glendale. The Adventist Health Community Wellbeing mission statement is living God's love by inspiring health, wholeness, and hope, coupled with a vision to transform the health experience of our communities by improving health, enhancing interactions, and making care more accessible. I helped to rebuild the program of Community Health and Wellbeing, CWB, at Adventist Health Glendale, AHGL. This fellowship provided me the opportunity to work on 4 different projects: the Glendale Healthier Community Coalition, GHCC, the Adventist Health Glendale Go Heart Program, Adventist Health School Wellness Programs, and the Community Health Needs Assessment, CHNA, which are part of rebuilding the Community Wellbeing Program. I mainly focus on the GHCC program, which as a collective impact model was on break for 2 years due to COVID, but restarted the project with a new focus on community-based leadership. I built a community of different program partners and organizations on networking, information sharing, and collaborating on projects to create healthier communities for Glendale and its surrounding service planning areas. For the GHCC project, I identified YMCA as the backbone organization, built a project team, and created a new vision with 3 main functions. I created a project timeline to restart the GHCC project. The outreach plan for this GHCC project was to re-engage partners and the website relaunch. The operations plan is currently planning 3 summit events and building towards a big fall summit in October. The lessons learned from the GHCC project were to use a collective impact model. This is driven by needs, voice, and contributions of partners. I learned that this approach takes time. This model was based on relationships, which were the key determinants of success. This required me to use a range of communication styles. The benefits of this approach were efficiency, that this can be done with little resources since all partners contribute to what they have available. I learned to make initiatives more relevant, sustainable, and successful. Thank you to the Randall Lewis Fellowship for this opportunity and my preceptor, Justin Henderson, who mentored me this past year. Thanks for listening.
Hi, my name is Leilani Sana Martinez. I am a second-year student at the Claremont Graduate University in the program of Masters of Public Health with a concentration in applied biostatistics and epidemiology. I have been interning at the City of Eastville since October of 2021 in the planning division. Through my internship, it has been mainly focused around how the built environment has such an impact in making sure that our communities stay healthy by promoting community engagement and mobility. Some of the aspects that my project has focused around is creating visual concepts for two major development plans that their main goal is to build a healthier community, promote exercise, promote community engagement. Additionally, we have been able to work on the bicycle plan and just updating and bringing up to date current documents that we have on the bicycle routes that have been accomplished since the proposal in 2016. And this will allow for the assessment of the additional bike routes that need to be created to continue promoting mobility in the community. Lastly, we have focused around reviewing policies and goals. These include healthy community goals, overall health policies, good government policies, and economic development goals. These are projects that are still undergoing, and it has been a great opportunity to learn just more about the city as a whole and just how important the built environment is to all our cities to create a healthier community. Thank you so much.
Hello, my name is Alexis Garcia, and I am currently a Master of Public Health student at Cal State LA. I have been a Randall Lewis Health and Policy Fellow with the City of Montclair for the past 6 months. During this time, I have worked on multiple projects with the goal of achieving health equity in the City of Montclair. A major project I undertook consisted of program evaluation of both the senior nutrition and senior transportation programs. This was done by analyzing the survey data via SPSS, which then allowed me to find any gaps in service and provide recommendations for program improvement. Program evaluation is integral to health equity because it ensures that the programs are adequately serving their intended populations. Another project I undertook consisted of a program recommendation for a mental health crisis response program to be used for future use by the City of Montclair. The pandemic has only exacerbated mental health issues among vulnerable populations. Therefore, a dedicated program with qualified individuals was developed in order to mitigate potential deadly outcomes that may occur with just police response to these situations. I would like to thank the Randall Lewis Health and Policy Fellowship for this amazing opportunity, and a special thank you to my site preceptor, Alyssa Kalunga, for the guidance on these projects. Thank you.
Hello, my name is Lindsay Valenzuela, and I'm currently working on my master's in health administration at Loma Linda University. For my Randall Lewis Fellowship, I was matched with Communities Lifting Communities. CLC is a community health improvement initiative led by the Hospital Association of Southern California. CLC is focused on reducing health disparities in Los Angeles, Orange, Riverside, San Bernardino, Santa Barbara, and Ventura counties. In my time with CLC, I was able to work on 2 separate projects. The first project I worked on was creating a showcase piece for the Ventura County Community Health Improvement Collaborative. The showcase piece was to highlight regional collaboratives and health initiatives. For example, the Ventura County Community Health Needs Assessment and the Community Health Implementation Strategy. This project required a great deal of research and interviews with 2 of the Ventura County collaborative leaders. At the beginning of this year, I was able to wrap up the showcase piece and started on my second project. The new project was to identify tactics and strategies on how community groups can engage hospital executives to make the case for investments in a community health improvement strategy. This project also required a lot of research, and I was able to create a community health engagement toolkit. Overall, I had a wonderful experience working with the CLC team and learned a lot about our surrounding community in Southern California. All the research inspired me to look for more ways to positively impact our local communities. Thank you for watching.
Hello everyone, my name is Mandeep Binder. I'm a Master's of Health Administration student at the University of La Verne. As a Randall Lewis Health and Policy Fellow, my main focus was on food insecurity and student hunger on college campuses. Food insecurity is a lack of availability or access to a sufficient quantity of food or adequate quality food. This is due to socioeconomic or geographic barriers such as lack of affordable housing, unemployment, or systemic racism. Studies have found that the rates of food insecurity prevalence on campus is 20% to over 50%. This rate is higher than the 12% rate found in the entire population of the United States. Therefore, food insecurity is a growing issue not only in the United States, but on campus community as well. For this reason, my work at the Leo Food Pantry at the University of La Verne centered on improving pantry operations to meet this need. My focus at the pantry was to create a best practices manual, which includes research conducted, eligible grants, the application process and requirements to establish community partnerships, and recommendations on improving the pantry. I began by conducting interviews with 16 universities regarding their policies and procedures. The first round of interviews consisted of smaller private universities in Southern California, followed by a second round of interviews with larger universities across California. The next focus was exploring how to increase resources and funding in order to expand our monthly distribution to a bi-weekly distribution. This consisted of researching and building partnerships with community pantries and organizations. In addition, I researched and presented eligible grants that can be explored. Lastly, the manual concludes with recommendations based from my research. These recommendations include short-term and long-term strategies the pantry can implement over the next 3 years, which can be found at the bottom of the poster. In the next academic year, the focus is to increase awareness about the pantry through tabling events and campus partnerships, as well as increasing distribution from once a month to twice a month by partnering with the local food pantries. Some examples for the long-term goals are to increase healthier food options by providing perishable food items and to either increase distribution to every week or change the operations of the pantry from a distribution model to a grocery model to give students more autonomy and to reduce food waste. Overall, this manual will be utilized to improve the pantry's operations and advocate for systemic changes that are required to help reduce food insecurity and student hunger on campus. I would like to thank Randall Lewis Health and Policy Fellowship for this opportunity, my preceptors Sarah and Adrian for their guidance and support, and all of the universities that allowed me to learn about their pantries. Lastly, I would like to thank all of you for listening.
Hello, everyone. My name is Mario Mendoza, and I am a Master's of Public Policy candidate at UCR. And my site was at the City of Ontario for this fellowship under the Community Life and Culture CLC agency, with my preceptor being Lacey Reitmer as a Senior Management Analyst. So the purpose of this initiative, the Mental Health Initiative, is to focus on providing of resources and seeing out what exactly is the community or where is the community at based off of the global pandemic, as well as local events that have occurred. So we want to see their mental well-being. It fell under CLC as CLC provides resources on health and understanding leisure. And this is where we kind of focused on with our survey as one of the components of the initiative. And really under this, we focus on the mental well-being. It falls under also in the area of Healthy Ontario, the CLC oversees, as it encompasses the healthy well-being of a person in the wellness as well as health and as well as the safety of individuals. So the purpose of this initiative is to create partnerships within local clinics and working with internal and external agencies of the community in local government. So that was working with school districts as well as working with individuals within the city itself. After this, we worked with the mental health task force, and this task force really helped create the assessment that was used to see exactly where is the mental well-being of the community itself. And after evaluating these, we created workshops with the partners that we created to provide effective services for based off of community needs. So we want to highlight two areas. So the first is understanding the community's knowledge on resources. So as you can see, 1/3 of them really knew exactly the resources that were put out there for them. And this is really important, 1/3 of it being very low. So 2/3 of them could potentially say that they didn't really know confidently. And we wanted to make sure that we provide that through community fairs as well as providing effective workshops that really dive into conversations of mental health and breaking down that stigma. The next that we want to highlight is illustrating the disruption that in folks dealt with. About 50% of respondents stated that they did have negative outcomes and negative tendencies on their daily lives based off of what is currently happening. So we really want to make sure that through these efforts, we continue to promote mental health, and hopefully the city continues to find ways and create funding for this in the long term, as it really focuses on areas that really need to be addressed for the community itself.
Hello and a warm welcome from my side. My name is Max Prupsla. I am currently a graduate student at La Sierra University in Riverside. And over the past couple of months, I've had the very fortunate opportunity to work at San Antonio Regional Hospital in Upland. Together with the marketing and strategy department there, I've worked a lot with data that we have collected from the California Department of Healthcare Access and Information. And I've used tools like Optum Market Advantage, Advisory Board, ArcGIS, Esri, and other data platforms to create reports on market share analysis of our primary and secondary service areas. I've created reports on payer shifts in these service areas and created snapshots of our hospital service lines, which are vital for the directors of those service lines. And I've also mapped different demographic shifts in the areas that we as a hospital serve. In all of this, I've mainly looked at 5-year historical data and tried to visualize for the people who will be looking at these reports the trends over the past 5 years. And then using those trends, I've modeled upcoming developments in the next 5 years. A lot of what I've done flows into the upcoming new 5-year strategic plan that San Antonio Regional Hospital is currently developing. And what we as a strategy department try to do with all this data and information is give everybody involved in the process of the planning a solid baseline and foundation that they can build on in order to know what has happened in the past 5 years, what might we be able to expect in the upcoming 5 years in terms of demographic shifts, how will our patient demographic shift, and how will the population demographic in our service area shift, and how can we best adapt in order to meet their needs and take care of our community as best as possible. These things take into account shifts in insurance coverages, age, ethnicity, gender, income, employment rates, and things of those sorts. And over the past couple of months, I've really had fascinating insights into how a hospital operates, how strategic decisions in a hospital can affect patients, but also how demographic shifts of those patients affect how we as a hospital need to make our decisions. The fellowship has really offered a tremendous learning curve for myself. I've grown professionally and personally. I want to thank everybody at San Antonio Regional Hospital that I've worked with, and everybody at Partners for Better Health and the Randall Lewis Health and Policy Fellowship. It has been a tremendous opportunity. I'm very grateful and thankful, and I'm sure that all of my fellows feel the same way. It's been a great opportunity, and I'm very thankful, especially also to Randall Lewis for making all of this possible.
Hi everyone, my name is Nadia Zaglari, and I am a 2022 Randall Lewis Health Policy Fellow. I am receiving my master's degree in public administration from the University of La Verne. I am currently working as a fellow at the City of Rancho Cucamonga within the City Manager's Office. I work directly with the Healthy RC team, whose mission embraces the comprehensive, interrelated nature of health and works in partnership with all sectors to create a healthy and sustainable community. My project focuses on coordinating a free annual wellness event for high school teens in Rancho Cucamonga called the Teen Summit. This is the 4th year Health ERC has organized this event, and every year has organized it around the needs of teens within the community. Through various surveys and focus groups, we learned that teens are having a difficult time coping with stress. Due to the isolation experienced through COVID-19, teens express that they are struggling with their mental health and experiencing burnout. The resulting lack of connection from the pandemic has contributed to the difficulty coping, so we sought out to put on an event that focuses on connection. Our theme for the 2022 Teen Summit was Connect. Connect with yourself, your friends, and your community. We were really happy and fortunate to be able to coordinate an in-person event this year that really allowed these teens to connect through activities that inspired vulnerability and self-expression. One of our main activities included a privilege walk, which served to raise awareness of various forms of privilege and understand the intersectional identities that shape individuals. The teens were engaged in the discussion of this activity, and many became vulnerable and shared their own stories. This inspired connection between the teens and made them feel like they weren't alone in their struggles. The teens also participated in art therapy, goat yoga, animal therapy, and received valuable connections and resources from our resource fair, which included many important organizations from our community. At the end of the day, it was clear that an impact had been left on these teens, showing that the 2022 Teen Summit was a success. The teens openly expressed how much they enjoyed the event and how helpful it was for them to reconnect with others, all while acknowledging their own vulnerability and struggles within a safe place to share them. Health ERC's collaboration with local organizations and local teens led to an event with great amounts of connection to assist these teens in coping with their mental health through the pandemic. The teens also received valuable insight from our incredible panelists and keynote speaker. I feel so fortunate to have been a part of this event, and I thank the Health ERC team for the wonderful experience. Thank you so much.
Hi, my name is Rachel Oliver, and I'm a Master of Public Health student at Azusa Pacific University. I collaborated with the Randall Lewis Health Policy Fellowship, the Center for Better Beginnings, and my preceptor, Dr. Teresa Dodd-Buttiera. My project focuses on the adverse effects of marijuana use during pregnancy, breastfeeding, and postpartum periods, and specifically how the legalization of both medicinal and recreational marijuana has negatively impacted maternal health. All relevant evidence was compiled into a scoping review to discuss the impacts marijuana has on pregnancy, breastfeeding, and postpartum stages. Marijuana use in pregnancy can cause problems with neurological development, resulting in hyperactivity, poor cognitive function, and changes in dopaminergic receptors. Marijuana use during pregnancy can potentially restrict fetal growth and cause stillbirth or preterm birth. As you can see from my poster, marijuana is the most common illicit drug used during pregnancy, with a prevalence of use ranging from 3 to 30% in various populations. We found this increases to 15 to 28% among young socioeconomically disadvantaged women. 34 to 60% of marijuana users continue use during pregnancy, with many believing that it is relatively safe. Research also found that an estimated 84% of marijuana users continue to use during lactation. And we found that a Maryland study reported that 62% of women who consume cannabis during pregnancy reported that they would increase cannabis use if it were legalized. And as of 2021, only 9 states in the US have mandated marijuana products to have warning labels for women who are pregnant and breastfeeding. Our results also found that 48% of healthcare providers did not provide counseling to patients who disclosed marijuana use, leading women to perceive adverse outcomes associated with cannabis use were not significant. Our results also found that nearly 70% of Colorado cannabis dispensaries recommended cannabis products to treat nausea in the first trimester. So my proposed health policies include all states should have a mandate for marijuana products to have a warning label for pregnant and breastfeeding women, and nationally create a mandatory training for cannabis dispensary about the harms associated with women who are pregnant and or breastfeeding, and then provide a mandatory education program to discuss the dangers of marijuana associated with pregnancy to be included in healthcare professionals' education curriculum and also in high school education curriculum, since younger populations were more at risk to use when pregnant or breastfeeding. In conclusion, the overall research has concluded that women should refrain from the use of marijuana while trying to get pregnant, during pregnancy, and while they are breastfeeding. Healthcare professionals should emphasize that there is no known safe amount of marijuana use and encourage support and referral for cessation. Thank you for listening to my presentation, and I hope you enjoyed my poster. Thank you.
Hello, everyone. I am Ricky Herbin, and I am a 2021-2022 Randall Lewis Health Policy Fellow. I have been placed to work with Jamboree Housing Corporation at Clark Commons in Buena Vista, California. I work within the Community Impact Department of the organization with my preceptor, Ben Sanchez. We work on several programs and services that help benefit the overall health of the community here at Clark Commons and the surrounding communities as well. I decided to conduct a survey to understand the context and breadth at which the current COVID-19 pandemic has impacted children's mental health ages 5 to 17. I used the social determinants of health as a framework to conduct this data. The survey consisted of 14 questions, majority of which were closed-ended and several were open-ended. It appeared that children have been affected in numerous ways by the COVID-19 pandemic. Some results have found these conclusions. Stable housing was a significant barrier for about a quarter of the participants, furthermore displaying the need for more affordable housing and permanent supportive housing. Those who lost a loved one to the virus, majority of them were fortunately able to access grief-related services. And overall children's mental health seems to have been negatively impacted due to the pandemic as it was seen in the data. And half of the kids now have increased stress and anxiety as well. Some major takeaways found from this data. I found that school-age children are struggling as well due to the pandemic, even though the notion kids are resilient is present in the dominant culture. It appears that many of the participants were able to access services, but unfortunately for some, there has been lack of access to these services. There is a need for more support for kids to gain access to food sources, stable housing, COVID-19 related services, and mental health services. Furthermore, I wanted to give a special thank you to Ben Sanchez, my preceptor, and Teresa Rivera at Jamboree for all the support and guidance you gave me throughout my fellowship. I also want to thank all those at the Randall Lewis Health Policy Fellowship, including Janie Boren, for this amazing experience that has helped me grow so much professionally and personally throughout the duration of my time here. And with that, I conclude my presentation.
Hi everyone, my name is Sarah Dergali. I'm a master's student at the University of California, Los Angeles, studying urban and regional planning. During my time as a Randall Lewis Health and Policy Fellow, I worked at the City of Riverside on 2 projects that simultaneously addressed the goals set out in Senate Bill 743 and Senate Bill 1383. The 2 projects were undertaken to address environmental and public health concerns related to rising greenhouse gas emissions. With respect to SB 743, one part of my project looked at new developments in terms of their transportation impact and focused on a measurement called Vehicle Miles Traveled, also known as VMT. As part of the fellowship, I worked with a team to create a request for proposal for a VMT mitigation bank. The goal of the VMT mitigation bank is to counteract the negative impacts of new developments on the environment through a monetary value associated with VMT reduction. The funds could then be applied to local VMT reduction projects and actions. Alongside this project, I began constructing the city's fiber cable map. The goal of this was to synchronize traffic and so reduce traffic delays between intersections where traffic signals are used. Using the measurements I documented of the required fiber cables, I was able to create a record of funding needed to move that project forward. The second part of my project aligns with the goals outlined in Senate Bill 1383. During the fellowship, I had the opportunity to create educational and outreach materials that promoted Riverside's food waste pilot program on organics recycling. These efforts were aimed at reducing short-lived climate superpollutants that are primarily emitted through landfills. We distributed the completed materials to the city residents as well as made them available on the city's website. Following the distribution of the materials, I also worked to develop a survey to gather suggestions and recommendations on how to improve the program before it's rolled out to all the residents of the city. I'm continuing to work with a team to review and assess the results of the survey to determine how to enhance the program. The projects could go much further than what was completed during my time working on them, but ultimately, the city's decision to roll out these projects will have a significant impact on the greenhouse gas emissions in the future, as well as provide residents with information about personal mitigation options for greenhouse gas emissions. Throughout the course of the fellowship, I have learned how city and local government function together, the importance of community involvement in public programs such as the food waste program that's been established, and the intersectionality of government and public health. I know that the tools and skills I have learned here will only enhance my professional career and better equip me in my future endeavors. Thank you so much for your time and for listening to this presentation.
Hello, my name is Sarah Santana, and I am a Master of Health Administration student at the University of La Verne. Through the Randall Health and Policy Fellowship Program, I was matched with Kaiser Permanente's Impact Spending Team in Pasadena, California. The Impact Spending Team makes spending decisions that are socially equitable, environmentally sound, and economically viable. By leveraging Kaiser's assets and economic resources, the Impact Spending Team helps to improve the socioeconomic and environmental social determinants of health in the communities that they serve. The efforts and work by the Impact Spending Team are activated through supplier diversity, sustainability, and economic impact. During my time as a fellow, I was able to participate in the Business Resiliency through Employee Ownership project. This project included one of our small, diverse supplier companies that was heavily affected by the COVID-19 pandemic, known as Courier Corporation of Hawaii. Studies have shown that due to the pandemic, 41% of Black-owned businesses and 26% of women-owned businesses were forced to shut down, causing a loss in jobs and economic revenue. The Impact Spending Team wanted to change the outcome for Courier Corporation of Hawaii by supporting them to become an employee-owned company. Employee ownership results in multiple benefits such as increased median incomes, job tenure, and increased profit margins. By partnering with two organizations known as Oberon and Project Equity, Kaiser Permanente provided educational information and transitional support to help Courier Corporation of Hawaii shift their employees to owners. The Business Resiliency through Employee Ownership project contributes to increasing both individual and community wealth building, access to benefits, and shared retirement. And converting Courier Corporation of Hawaii to employee ownership supports jobs and the local economy. In addition, I am helping to develop a communication strategy for the Impact Spending Team to increase the visibility of their work, in which the Business Resiliency through Employee Ownership project will be featured. The strategy will also highlight the business model of combining social and economic perspectives into operations that support equitable community development. I would like to thank the Randall Lewis Health and Policy Fellowship for giving me the opportunity to work with Kaiser Permanente, and most importantly, to my preceptor, Andaye Hill Espinoza, for her support and mentorship throughout this experience. Thank you.
Hi, my name is Sarah Winglars. I am a Master of Public Health student at Claremont Graduate University and current Randall Lewis Health and Policy Fellow. I have had the pleasure of working with Jamboree Housing Corporation in Irvine, California for the past 6 months. Jamboree Housing is a nonprofit organization whose mission is to deliver high quality and permanent supportive housing to formerly homeless individuals and families. After learning more about the causes and concerns, it was clear that the issues pertaining to homelessness are much more complex than just housing affordability alone. At Jamboree Housing, they strive to not only house their residents permanently, but to supply them with the skills, knowledge, and foundation of being able to live healthy and thrive. My first project was to conduct a needs assessment, and I first began with interviews across Jamboree staff. I needed to hear their side and understand what they felt was necessary for the residents to succeed. After that, I used an ArcGIS survey platform to ask residents a series of questions relating to their overall health and safety within their current housing sites. Overall results showed that 12.33% of residents did not feel safe, and 13.7% claimed to have felt unhealthy. Approximately 15% of residents expressed that they were not content with where they lived, indicating a need for a resource evaluation. Residents were also given the opportunity to specify what they would like to see more of at their current housing sites, and a majority expressed the need for improved safety and security measures. From the needs assessment, my future projects involved creating health promotion programs and documents, which included a walk to wellness program where residents will be given pedometers, and whenever they reach a certain amount of steps, they will receive a prize. Other work products included 30-day challenges and a compilation of health assessments and questionnaires aimed at improving physical and mental wellness. To address the safety and security concerns, Jamboree is implementing strategies similar to the See Something, Say Something campaign. I focused on 3 cities that have shown to have highest rates of crime within the Jamboree housing sites, and I used that data to create brochures and flyers to inform residents on the types of behaviors or indicators of crime to look out for. I also provided them with the proper resources and contact information so that they could assist in reporting crime in hopes of decreasing overall crime and increasing safety measures. The final project was the creation and organization of an on-site resource and wellness fair, which is aimed at bringing various resources directly to the community. Booth participants were recruited from organizations in the Orange County area. Overall, the needs assessment allows for expansion in physical and mental health resources, increased safety and security, and establishment of future partners in collaboration. To conclude my presentation, I want to thank my preceptor Danielle Lattery for collaborating and guiding me through this journey, the Randall Lewis Fellowship, and colleagues, faculty, and staff at CGU for always being so supportive throughout the entire program. Thank you for your time.
Hi everyone, my name is Seda Koulian and I'm getting my master's in public health at the University of Southern California. I had the privilege of working at Adventist Health Simi Valley under Catherine Stiles in the Department of Community Integration. This was an extremely rewarding experience by upholding their mission, which is living God's love by inspiring health, wholeness, and hope. I specifically focused on adverse childhood experiences, which is also known as ACEs. We believed positive change comes from raising awareness among parents to prevent and stop the cycle of generational trauma and abuse. I conducted extensive research to create frameworks in order to help overcome this issue, and the frameworks focused on community involvement, an internal framework for the hospital itself, and an external framework for local community organizations and partners. Each framework was tailored by 3 to 4 different phases that would aid in overcoming this issue while keeping the target population the parents. I was also very fortunate enough to work with a partnering organization for the Need Foundation, which focuses on youth experiencing homelessness. For this organization, I created an ACEs PowerPoint guide for volunteers to obtain information on the issue, as well as training tactics to identify ACEs among individuals. I also researched local resources available for people in the community, such as financial resources, free to low-cost health services, food pantries, homeless shelters, and more. Lastly, I developed a framework focused on the importance of trauma-informed care in a non-clinical setting. I have learned so much from my time at this fellowship and have met amazing people who continue to expand my knowledge. It was so wonderful to be placed out in the field of public health and have hands-on projects and experiences. I'm so grateful to have this opportunity, and I thank you all for listening.
Hi, my name is Tanya Lee Sanchez. I'm coming from the University of La Verne, and I was partnered with City of Fontana, specifically Healthy Fontana. Part of our project and things that we really wanted to highlight this year with the help of grants that were already presented to Healthy Fontana was really wanted to focus on mental health and bringing more mental health awareness through programs that were already existing, and we really wanted to shift the focus to community gardens in a way to mitigate health and mental health as well, because we have lots of great research, at least I was able to find great research that proves that community gardens are great ways to mitigate both cost in food as well as a way to mitigate mental health, because it makes a great de-stressor. Part of what I did throughout the year was one of our community events, I came out and did a survey on food and food insecurity and asked people what some of the concerns were around food. And a lot of them overwhelmingly didn't say that they had an issue accessing or getting to a grocery store. It was an issue with cost. Cost was a big one. On average, people said they spent $500 or more per month. A few people did say that they had government assistance assisting them in helping them purchase food, such as WIC or food stamps. Most of them, again, biggest concern was cost. So with that, knowing that information, we were able to kind of cater that around what we wanted to see within the community garden. So once we were able to get that program kickstarted, and we partnered with the San Bernardino County Master Gardeners, who came out and actually did a presentation on starting from seed, and they gave us great information on how to get our own garden started, what we can use. We were able to get part of the findings, and some of the results were a lot of people said that they really enjoyed gardening as both a tool for mental health distressing. They said it was calming, it was relaxing. So it's great information to have, especially for going forward for any more grant funding. We also were able to gather information. A lot of people said that they did it because they wanted to cut cost, and they also gave us information, and they told us exactly what they wanted to see in their community and in their gardens, and information that they wanted from drought resistant gardens, from information on how to keep critters out of the garden. So that was really great. And again, it just highlights the importance that community gardens can give to a community, is that they are a great way to de-stress, not only from taking the stress away from the cost elements, to taking the stress away from getting out there and moving, as well as a great physical fitness program. Just moving around is great, and it's a great way to socialize. And just those were kind of some of the results, and going forward the city will kind of have that information. And again, I just wanted to say thank you to Randall Lewis, the program, and my preceptors, and everyone here, as well as everyone at the City of Fontana, all the volunteers that it took to make those events happen, as well as Jasmine, especially Jasmine, who was my main preceptor that helped me put everything together and give me all the information and provided me with all the guidance. Again, thank you everyone.
Hello everyone, my name is Victoria Montiel Perez, and I am a second-year student at the University of La Verne. I am pursuing a master's degree in health administration, and I am currently a fellow at the Kaiser Permanente Fontana Pediatric Clinic. Kaiser Permanente's mission is to provide high-quality, affordable healthcare services and to improve the health of its members and the communities it serves. My project at Kaiser Permanente focuses on increasing the pediatric immunization rate. Currently, the Kaiser Permanente Fontana Pediatric Clinic is not reaching their Combo 1 Adolescents Clinical Strategic Goal month over month. Combo 1 includes the meningococcal, tetanus, diphtheria, and pertussis vaccines. The Combo 1 vaccines help prevent the spread of disease and illness. To evaluate the Kaiser Permanente Fontana Pediatric Clinic, various methods were utilized. Surveys were used to collect customer data. Observations were also used. They consisted of interactions between injection staff and patients. The injection staff includes licensed vocational nurses and medical assistants. The observations allowed me to gain a detailed understanding of the process, people, inputs, and controls of the clinic. Various staff members were also interviewed. The goal of these methods was to identify the drivers of low vaccination rates. Through the research conducted, it became obvious that the injection staff is not fully utilizing tools provided to them, such as the Proactive Care tab, the California Immunization Registry website, and the Reconcile button. What I am recommending is that the injection staff increases their use of the Proactive Care tab, Care website, and Reconcile button. By having staff click on the Proactive Care tab and having them address care gaps, we hope to improve the quality performance at the Kaiser Permanente Fontana Pediatric Clinic. To conclude, I would like to thank the Randall Lewis Health Policy Fellowship for giving me the opportunity to work with the Kaiser Permanente Fontana Pediatric Clinic, as well as my preceptor and coach for mentoring, educating, and supporting me. Thank you.
Hello. My name is Wakanda Cotton Curtis, and I was able to work with the Los Angeles Department of Public Health's Maternal, Child, and Adolescent Health Program Division, thanks to the Randall Lewis Fellowship. To address the birth inequities in the African American community, The Los Angeles County Department of Public Health created programs such as the African American Infant and Maternal Mortality Community Action Team. One such program can be found in the South Los Angeles and South Bay regions, which is where I was fortunate enough to conduct my internship. The African American Infant and Maternal Community Action Team, also known as AIMCAT, was founded in 2018 by Miss Ajua Jones, a visionary creator and my own preceptor, with the goal of bringing together community and local government to reduce Black African American infant and maternal mortality rates within the South Los Angeles and South Bay areas of Los Angeles County. This is also known as Service Planning Areas 6 and 8. This organization offers free community programs and work groups to help new parents and nurturers navigate the challenges, tribulations, and advocacy channels that come with being a new or continuing parent and nurturer. My internship entailed examining policies that affect African American Black women, their infants, and their families, such as insurance company policies, hospital rules and regulations, racial equity policies, and workforce economic development efforts. Providing outreach and engagement to community members and stakeholders, assisting with advocacy and education on various health and awareness topics, as well as assisting with event planning and attendance forms, assisting with the identification of family-centered best practices and standards of care were among the methods that I was able to utilize. At this time, I would like to credit the Randall Lewis Fellowship with providing me the opportunity to learn and educate not only myself, but others in the community, incorporating the necessary tools for self-advocacy and education, all in the hopes of reducing infant and maternal mortality in the community. Thank you.
Hello, my name is Yvonne Nebechi. I'm a second-year Master of Public Health candidate at California State University, Northridge. With my Randall Lewis Fellowship, I was matched with Adventist Health Simi Valley. My preceptor's name is Catherine Stiles. My job responsibilities at Adventist Health Simi Valley have allowed me to work on substance use disorder-related stigma programs. With our program Shining Light, we aim to reduce SUD-related stigma in Simi Valley and surrounding regions. After surveys and analyzing statistical evidence and previous research or studies, we found that teenagers and young adults are most likely to experience SUD-related stigma. According to research, stigma is one of the primary risk factors for poor SUD outcomes. Treatment is delayed as a result of stigma. It also decreases the likelihood of a person with SUD receiving appropriate and adequate care and also adhering to treatment or therapy. As a result, we developed an evidence-based strategy, which is a learning curriculum to address SUD-related stigma. For our first target group in Simi Valley, teenagers and young adults, our program was guided by the construct of attitude, perceived severity, perceived risks, perceived barriers, subjective norms, self-efficacy, and behavioral intent. The learning curriculum with supporting activities was focused on each level of stigma. Our perceived outcome is that the Shining Light program will help to reduce SUD stigma in Simi Valley communities and surrounding regions, particularly among our first target group. Frequently, society perceives SUD as a moral issue, not knowing it is a health issue. Educational awareness, such as learning curriculum brought by the Shining Light program, will help to reduce the detrimental impact on individuals, families, and communities with SUD stigma, which will help them to regain their lives back and also increase their quality of life. I sincerely express my gratitude to Randall Lewis for giving me this opportunity, and I thank my preceptor, Catherine Stiles, and Sean Wilson for guiding and supporting me through this inspirational and enlightening journey. Thank you.